in other words known as HIPAA. Next page, please. The origin of HIPAA. Way back on August 21st, 1996, the Health Care Insurance Probability and Accountability Act was signed into law as an act to improve the portability and accountability of health insurance coverage for employees between jobs. Next slide. HIPAA's roots go back to the early 1990s when the medical industry felt that they needed to become more efficient by using electronic medical records. They also realized that they needed standards regarding the management of new data. Next slide. In 1996, the law was passed by Congress and signed by Bill Clinton. While the law itself was passed in 1996, the actual details were left to future specifications by Congress, as well as the Secretary of Health and Human Services. The privacy rule was the first aspect of HIPAA to be finalized in 1999. Next slide. So now we're on part 2. Who's doing part 2?
So now we're on part 2.
I am. Privacy of patient information. Next slide. The next slide, please. Okay. HIPAA privacy rule establishes national standards to protect individuals' medical records and other personal health information. It also applies to health plans, healthcare clearinghouses, and those healthcare providers that conduct certain healthcare transactions electronically. The rule requires appropriate safeguards to protect the privacy of personal information and sets limits and to request corrections. Next slide, please. The privacy rule protects all individual indefinitely held information held or transmitted by a covered entity or its business associated in any form of media, whether electronic, paper, or oral. The information includes the individual's past, present, or future physical or mental health or condition, the provision of health care to the individual, or the past, present, or future payment for the provision of health care to the individual, and that identifies the individual or for which it is a reasonable basis to believe can be used to identify the individual. Next slide, please. Now, the major goal of the privacy rule is to assure the individual's health information is properly protected while allowing the flow of health information needed to provide and promote high-quality health care and to protect the public's health and well-being. Next slide, please. I'm not sure who's doing this part.
This is my section. This is Lauren. I just wanted to make sure I was set to go. Can everybody hear me okay? Okay, perfect. So this part is over portability of the Health Insurance Portability and Accountability Act. So can you go ahead and go to the next slide? So the first part of it, there's kind of two sections that are covered under portability. The first one is the actual portability part of it. It protects an employee's rights to keep certain health insurance benefits and 401k/health savings accounts when switching employers or retiring. It states that employee/group health insurance plans may not deny coverage due to pre-existing medical conditions, and it ensures that people will have access to individual health insurance plans. And next slide, please. So to just help you understand what portable health benefits are, there's a couple different requirements basically. The first one is that the benefits that employees have paid into or accrued through their employer during the duration of time with the company. They must be capable of being transferred to a new employer's plan or being paid out to the employee if retiring. And it includes any contribution-based plan, including health insurance, health saving plans, 401k plans, and more. And next slide. And then the last one is what the bulk of the information was about. So group insurance companies may not deny coverage to pre-existing medical conditions and current health status, include spouses and dependents who are on the insurance policy, and must provide people in special circumstances the opportunity to apply for individual coverage. So this is basically just guaranteeing that people with chronic illnesses will always have access to health insurance. And this, for the most part, is really only talking about group health insurance plans. When you're applying for individual plans, that's when it kind of gets a little bit tricky, and that's when you can get denied. But as far as group health insurance plans, the ones that you would see when you're working for a company, that is what this would cover. And next slide.
Hey guys, can you hear me? Alright, so in this next section I will be talking about COBRA. No, we're not talking about a snake, but it is a gateway. It's a way of keeping your health insurance after you leave your job. I'll discuss what it is briefly, where it came from, the qualifications and triggers, and lastly what COBRA covers. And just on a side note, when I say triggers, I just mean the events that cause COBRA to take effect. So the word COBRA, oh, next slide please. Okay, so the word COBRA stands for Consolidated Omnibus Budget Reconciliation Act of 1985. I don't know about you guys, but that is a mouthful of big words, so I looked up the definitions. So to simplify it, it basically means to restore multiple items or benefits and making sure that they are solid and in place or can't be taken away. During that time, it was passed by Congress and signed by President Ronald Reagan, and it is a federal law that requires employers of 20 or more employees who offer health care benefits to offer the option of continuing their coverage to the individuals who lost their benefits due to a termination of employment or other certain events, which I will cover soon. Next slide. So if an employer is subject to COBRA, meaning they have a group health plan, they have to provide the COBRA benefits to the qualified individuals. So a qualified person is anyone covered under the company group health plan on the day before an event that causes the loss of coverage. That's a key point. So these losses of coverage include, the loss of coverages, they include employees, including part-time employees if they are participants in the plan on the day of the qualifying event, their spouses, their dependents, and retirees unless they're eligible for Medicare. Employers don't have to offer COBRA to individuals who, for example, an employee who is not eligible for the group health plan, an eligible employee who declined to participate in the group health plan, or any individual who is enrolled for benefits under Medicare. Next slide. And then just continuing on, so the triggers or events that trigger the coverage are known as the qualifying events. And this includes a range of triggers, so it is important for the employee and the employer to know how it works and what qualifies a person. The triggers include employee reduction in hours, a spouse's divorce or legal separation, an employee death, an employee's entitlement to Medicare, a change in status, active military duty, or failure to return to work at the end of family and medical leave, or even your business
bankruptcy. Next slide. So the following plans usually need to be offered to employees when COBRA is triggered, but only if the employer already offers them to employees. So this includes healthcare plans, medical spending accounts, dental, vision, hearing plans, prescription drug plans, alcohol and substance abuse plans, and also mental health plans. Once again, there's also an exception though: life insurance, disability insurance, retirement plans, and unfortunately, vacation plans are not covered in COBRA coverage, so no free vacations for anyone. But some of the things that both the employer and employee need to take in consideration is, depending on the type of event and who and what the trigger is affecting, COBRA can either continue for 18 months after the date of the event or coverage loss. And so if it was due to job termination or reduction in hours, or anything else besides job termination. Also, the employee is the one who generally pays for the full cost of the insurance premium, and the law allows the employer to charge 102% of the premium. And so if an employee gets extended COBRA coverage to disability, the employer can charge 150% of the premium for 18 months through 29 months. And so also timing of payments is important. The federal law states that COBRA coverage can be terminated if a premium payment is late. So just simply, it's more expensive, the employee pays full costs, the employer can charge a higher premium, and the coverage can be terminated. And next slide.
Okay, can everyone hear me before I start? Okay, so I'm going to be talking about violations and consequences of the Health Insurance Portability and Accountability Act. So we'll discuss what is a violation, what are the possible consequences, what is the procedure to report a violation, and how can HIPAA violations be prevented. Next slide, please. So a lot of the common violations, as I studied them, had to do with accountability for healthcare providers. So some of the common violations include authorization expiration date violations. These have to do with the forms that we sign when we go to the doctor, and they all we can set a date when that authorization we give expires. If they release anything after that date, that is a violation. Releasing information to patients. We have the right to receive electronic copies of medical records on demand. If we are denied that, that is a violation. Disposal of patient records violations. When our records are being disposed of, they must be shredded or completely destroyed if they are electronic. When disposing, if they are not, that is a violation. Insider snooping violations. This is maybe comes to play maybe if we have a family member who works at the medical office, or even a coworker. If we work in a medical office, they cannot look into our medical records without authorization. That would be a violation. Signature violations would be any HIPAA forms that don't have our signature on, don't have a patient signature, would then be then invalid. So no information can be released. If it is, that's a violation. Release violations, only the person listed on the authorization form, specifically the person we list, can receive any patient information. It also refers to releasing the wrong document that has not been approved for release. It actually also covers accidental releases to the wrong people. So we can choose as patients to partially release records or fully release records. That's completely up to us. So again, like I said, it could also be a careless mistake. Next slide, please. All right, so consequences were a little bit more difficult to maybe grasp, and I guess the slide is a little fuzzy here when it switched over. So there's different levels of accountability, I guess we could say. So if you unknowingly give out information, that's going to be a different fine than if you willfully neglected and that caused a violation. So I gave some definitions, like when they're saying unknowingly, the definition they gave of knowingly is having knowledge of your actions, that it is an offense. So unknowingly obviously is not having that knowledge.
there's going to be some, oh, I'm sorry, so I think it's on the other page. Some corrective action taken, but also there can be some monetary fines as well. The minimum for unknowingly is $100, but it can go all the way up to $50,000. Reasonable cause, it gets a little bit higher at the minimum, is $1,000 per violation. Willful neglect, that means perhaps the violation happened, but you corrected it on your own time, but there was still a violation, and so it's not as bad as, oh, those are not correct, but they're there. I just noticed that. There's willful neglect and just straight neglect, which would be uncorrected violation. And there's also criminal violations attached to HIPAA, and they're handled by the DOJ. Next slide, please. So if you believe that a HIPAA-covered entity or its business associate has violated yours or someone else's health information and privacy rights, you can file a complaint with the Office for Civil Rights. Complaints must be filed within 180 days of becoming aware of the violation, and there can be extensions granted. It said for good cause, so that is to the OCR's discretion. Once a complaint is filed, the OCR opens an investigation, and at the completion of the investigation, the entity or business associate must voluntarily comply with all HIPAA rules, take corrective action, agree to the settlement that we discussed, the monetary settlement before. Next slide, please. So this is a representation of the statistics as far as statuses of complaints up until January of 2017. So only 2% of complaints remain open. 98% are resolved, and there's a total complaints received of 148,282. Next slide, please. So some prevention tips. The business entities need to have clear policies for their employees in order to process the information of the patients. There needs to be employee training on those policies. All digital devices must be encrypted. There needs to be software firewalls on all digital devices, as well as malware scanning. And the software must be updated regularly. There needs to be tracking systems put in place so you know who touches what document and where it goes. And there needs to be clearance levels as to who is able to access certain information. And I believe that is our last slide, and there is our references, and that is our presentation on the Health Insurance Portability and Accountability Act.